We want the pandemic to end, sing these women in Gambia. But in many African countries, it's mainly men who are getting the jab, with inevitable consequences. In South Sudan, 70% of people testing positive for the virus are women. Why? It's because they're less likely to be vaccinated. Just a quarter of those who've got the jab there are women. What's behind the gender gap? I'm Ben Fazoulen. This figure will bring it home to you. 70% of healthcare workers worldwide are women. If they're unvaccinated, are they really able to care for those in need, the elderly, the more vulnerable, and children who are also at risk of spreading COVID even further?
The action finally gets going under the large mango tree, the traditional meeting point in the small village of Uwi in western Kenya. Nurse Harriet and her team hope to vaccinate 200 villagers against COVID-19. Their plan almost fell through. The village is more than an hour from the nearest clinic, and up to the last moment, the team didn't know whether they would get a vehicle for today's vaccination campaign.
At times, when we don't have the vehicle, we normally use motorbikes to go to the interior villages. Because now we really want to go vaccinate them, but then at the same time we don't have the means, so it forces us to use motorbikes. But again, motorbikes are not safe with our vaccine carriers, so that's why sometimes, if it's so hard, we just wait for support.
Support that should actually come from the capital, Nairobi, 500 kilometers away. Just a few months ago, the biggest problem was that richer countries were not sending enough vaccines. Today, the capital is well stocked, but the government doesn't have a plan to get the vaccines to remote parts of the country. Amnesty International activist Diana Gichengo finds it scandalous that the most vulnerable people are being neglected.
The few people in the middle class who understood why we needed the vaccine took all measures to jump the queue. And that left us falling very, very far behind in terms of focusing on the priority population.
Another problem is that many Kenyans don't want to be vaccinated at all. Conspiracy theories about rich countries wanting to halt population growth in Africa through vaccinations are going viral on social media. Fact-checker Alphonse Shiondu tries to counter online fake news. He's shocked that even politicians are promoting rumours. One especially controversial video features the Minister of Health in neighbouring Tanzania.
So she's addressing on why this is very important for them to use alternative medicines, why we should not trust Western medicine and stuff like that. That was very, very potentially dangerous and very, very misleading in the way it was styled, because she's saying no vaccines in Tanzania, we don't have COVID, take this and you'll be safe from any viral infection.
In the small village of Uwuri, too, just a few villagers are waiting under the mango tree for a jab. Harriet and her team didn't reach their target for today. In the end, they only managed 130 rather than the planned 200 vaccinations. They plan to go out to the villages again tomorrow, if they can get the van.
Sabina Wilke is Director of Communications and Advocacy at CARE Germany, an NGO. Let's just take a little look together at this vaccine gender gap in three countries, namely India, Timor-Leste and South Sudan, and just look at the difference between women vaccinated and men who've been given the jab. And we're talking about half or fewer than half. Are these exceptions, would you say, Sabina?
Thanks for having me. I mean, to be honest, it doesn't really come as a surprise to us humanitarians who've been working in emergency contexts and societies with harmful gender norms, but these play out now much more harshly with the COVID pandemic. CARE has been looking at figures from 24 countries, those three that you cited amongst them. And what came out quite clearly is that there's a really, really stark gender disparity and inequality when it comes to access to vaccinations, but also information and just freedom of movement for women.
And why the stark difference between developing and developed countries?
I mean, for once, the developed countries have been quite quick at, of course, making sure that their own population is being vaccinated. We have the COVAX initiative, which delivers vaccination to developing countries, but it's simply not enough. What we have to consider is what we've seen in the clip just before from Kenya, the last mile delivery. It's not enough just to provide vaccines and doses, but you also need to invest in healthcare systems. You need to pay health workers, you need to mobilize the communities, you need to ensure logistics, pay for cars, pay for gas, etc. So there's a whole logistical chain surrounded by that. And most of the countries that are on this list in terms of stark gender disparity and also not enough vaccination happening are countries that are suffering from chronic poverty or that are in crisis and in conflict situation. And that's why it's even more difficult to reach the most vulnerable.
And in general, what are the consequences? Because I mentioned women are often care providers and healthcare workers in many countries.
Exactly, and that's the main injustice. Around 70% of global health workers, both in the formal and informal sector, are women, but they're not being vaccinated to the same extent as men. So they take care of patients, but they're not protected themselves. Also, in terms of access to healthcare and other essential services, women are really disproportionately affected by this pandemic, and this is why we're calling really for a gender-sensitive approach to all vaccination campaigns, and to ensure that women get the information they need. Because what we've also seen in Kenya in the clip before is there are a lot of rumors, and what really concerns CARE is that many women hesitate, even if they are able or would be able to get a vaccination, because one of the main rumors around this is potential infertility, and this really is something that concerns a lot of women around the world and makes them hesitant to get the jab.
So again, like so often in this crisis, it comes down to an information campaign that's needed. Now, the more a virus replicates, the higher the chances a more transmissible variant may occur. Are variants like Delta and Omicron due to the unvaccinated, in your opinion?
I think it's difficult to say, and I would leave that to scientists. But what is clear is we have a stark injustice when it comes to global vaccination rates. Only 6% of the global South so far has received at least one dose, while 80% of all vaccinations happen in the rich countries, in ours. So, of course, I mean, Secretary General Antonio Guterres said right in the beginning in early 2020, we are not safe until everyone is safe. And this sentence still stands. And unless we really invest heavily in the last mile delivery for all people to get a vaccination and to understand what it means for their safety, we are not going to be safe in our countries, regardless of potential booster shots or next vaccination campaigns, etc. We really need to get everyone on board. And it's not, I mean, it's a complete injustice to think that your chance of getting a vaccination depends on where you live and how poor or how wealthy you are.
And whether or not you're a man or woman. Sabine Wilke, thank you very much for joining us from CARE Germany. Great to get those insights from you.
Thank you.
Now, recovered from or survived a COVID infection? Here's a viewer question for our science correspondent, Derek Williams. Who is considered a COVID-19 survivor? Is it regardless of its severity?
This is really more of a semantic question than a scientific one, but it caught my attention because I've used the term here quite often, but I've never really thought about it before. So let's think about it. The word survivor is a pretty dramatic one. The Cambridge Dictionary defines it as a person who continues to live despite nearly dying. Now, that definition certainly applies to the many people in this pandemic who contracted severe COVID-19 but didn't succumb to it, but not necessarily to everyone who tested positive for the disease. The two members of my immediate family who had mild cases of COVID-19, for example, they told me they wouldn't describe themselves as survivors. In scientific literature, the term is often, but not exclusively, applied to people who recovered after having been hospitalized with the disease. But there are also arguments for thinking of those who've recovered from even a mild case as survivors. Studies have shown, for instance, that there are increased longer-term risks for them as well of developing the range of symptoms commonly known as long COVID. And online support groups for the condition are full of people who got only a little sick from the initial infection, but have struggled ever since recovering with a wide range of ongoing life-altering complaints. Though I don't know anyone personally who suffers from long COVID, I'm certain that many of those who do would also consider themselves survivors who have to keep working to survive every day. So, long and short, there doesn't seem to be a really narrow definition of the word survivor in the pandemic. But because COVID-19 affects people in so many different ways, that shouldn't come as a surprise.
Derek Williams there. And finally, drug maker BioNTech has announced that it's not enough just to get the 2 shots of their coronavirus vaccine to neutralize the Omicron variant. The scientists there say 3 doses of their vaccine are showing a significant increase in antibody production. BioNTech has also announced it could have a new Omicron-specific vaccine by March next year. The new Omicron variant is spreading around the world, rising uncertainties and fears that the corona pandemic is getting worse instead of being under control. It's still unclear if and how existing vaccines are protecting against the new variant of the coronavirus. Nice to have you along. Stay safe and see you again soon.